Okay.
Hello, audience. Welcome to Doctor's Health Talk Show. I'm Dr. Farhan here. Today it is my pleasure and honor to invite one of my dearest friends, Dr. Sramila Aithal. She is a oncologist at the hospital that I work with in Philadelphia. And Sramila, welcome. How are you today?
Oh, I'm doing well. Thank you for having me, Farhan. I looking
I
forward to chatting with you.
I have to tell you, you are very photogenic, and I love the beautiful background that you have there. And thank you for taking the time to talk to me.
Oh,
I'm
thank
looking
you for
forward to.
having me.
I'm looking forward to a great discussion. You're one of those physicians that have always been extremely inspired and impressed. Let me tell you, when I started about 6 years ago at this hospital, I did not know you as well, and you used to come down and tell me uh, everything about that patient off of your head. You would know everything, and you would say, Farhan, this patient knows me for this long, and these are the problems. And I'm like, okay. And I was like, wow, how can she remember all of that? So I have to tell you that since then I've been your
Oh,
fan. Um,
oh, thank you, Farhan.
and your patients love you, staff loves you, so I wanted to bring you to rest of my colleagues, my friends and viewers, and see the human side of you. So tell us a little bit about your journey, your decision to come into medicine as a physician.
Well, I can say that as a child, I always dreamt of being a physician because to me at that time, it felt magical to be able to treat people when they are ill and then they become better. Later, at a younger age, my dad became ill. He developed diabetes and several complications from diabetes and was going through a lot of health issues. So I followed my dream and passion and was able to get admission into a medical school growing up in India in Bangalore at age 17. That's where I grew up. Unfortunately, my dad's health issues worsened and led to kidney failure, heart disease, requiring dialysis, and he deceased. He unfortunately did not live to see me graduate medical school. I'm sure he's smiling from heaven even till today. Um, on the
Oh,
first day of medical school, I actually met this classmate who came from United States to India to go to med school for the first time. And his unique personality, extremely loving nature, kind, very funny, um, had some kind of a aura around him, drew my attention to him. And years later, we're married against all odds. And that brought me to United States and my next phase of journey in life.
oh, beautiful. I have to say that all of what you shared is interesting, and it brought back some of my memories from the medical school. I have to tell you that my dad has diabetes. Fortunately, he is alive, and I think that all of us, when they become physicians, our families contributed to that. Your story is a little
Yes.
unique because you motivated yourself. Most of us Indian and Pakistani doctors, our parents tell us you have to be a doctor, so that's good.
You're right.
um, and thank you for sharing the story of finding your life partner through medical school.
Absolutely.
Um,
Absolutely.
so uh, that means that you must have left India soon after your graduation from the medical school. Is that true?
Yeah. Yeah, that's right. I mean, I was initially training while in India after medical school. I was training in OBGYN as a subspecialty. And when I got married, I moved to United States and I chose to train in internal medicine for various reasons. There's a broader scope of options for subspecialty training, especially being an international medical graduate. So talk about being in the right place at the right time. While I was waiting to get into residency, passing all those required exams, USMLE, I had taken up a small job as a teacher's aide at a CME company called Kaplan in Chicago. So I mentioned about my long-term career plan to one of those bosses there. one day as a casual sort of conversation. He immediately placed a word with one of his friends in New York City, who happened to be program director for a residency program in Brooklyn, New York, called Maimonides Medical Center. I went to meet him up, and the following year I got matched in that program. So I'm ever grateful for this chance encounter. So
I think
that
that
leads
was your
to,
dad's prayers, looking out
I'm
for his
sure,
little daughter, making the
I am
life of
sure.
her dream possible. That is a beautiful story. I remember we used to have like Kaplan books, which were like kind of copied multiple times and be sold for us to read because nobody could have the real ones. Did you
Right.
study Kaplan for
Yes,
CSA or
I
something?
actually, yes, I actually took up their courses to pass USMLE exam step 1 and 2. And after I passed, well, we had to wait for those um, applications to apply for residency programs. So I took up a job as a teacher's aide with them. And at that time, they were not only doing teaching for USMLE courses, they were also having some CME programs and so many other things. So I was
And
utilized in.
Maimonides in New York is a good hospital, very, very well respected. Did you develop interest in oncology while you were a resident there?
Yeah, so in my first year of internal medicine residency, it was one of the big buzz at that time in the field of oncology was the evolution of oral targeted oncolytics. So one of the first drugs that got approved, I clearly remember it was 2001, was Gleevec for the treatment of chronic myeloid leukemia. That was certainly fascinating to me because it changed the way, of course, for CML patients, and that drew my attention to oncology. And during my oncology rotations, while I was in internal medicine residency, one of the professors in oncology used to hold ethic rounds for his fellows, which I was able to attend. And that addressed a lot about how to talk to patients, give them bad news, how to talk to family members. I think that was a great exposure and really drew my attention, thinking that there's so much of challenge in talking to patients who have terminal illness and yet instilling hope in them. And so immediately in my second year, I applied to HEMONC fellowship program and got matched there. But so I was offered to become a chief resident in internal medicine, which is an additional year, and as it was a large program. So I was in a dilemma as to what should I do. Should I take up my fellowship or should I take up the chief resident? But my HEMONC director of the program was willing to move me to the following year and give me that opportunity. And so there was no looking back since then.
Oh, wow. I have to tell you two things that came out of that story is number one, you had your eyes and ears open because when I was a resident, I should have known about that Gleevec, that drug, because I was like, I wanted to be, an attending was telling me that I should actually go into um, oncology, but I was like, oh, oncology patients are not going to survive. I want long-term relationship. I'll become a rheumatologist. So you were smarter. You had your eyes open and you knew about the new drug that came out. I did not. Now, one
You would
more
have been
thing.
a great oncologist because you have certainly the compassion, kindness, empathy towards patient that's all needed in
I
this
have learned
field.
from you and from my other
Oh.
colleagues at this hospital. I have to tell you, thank you though for appreciating. And the other thing I just wanted to tell you was, y- you know, um, the the uh, the 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 passion, the compassion, and the history taking skills that you have, maybe it just comes natural in some individuals, but it's really important for oncology, and I see that you deliver that every day, hands down. My question is, any case while you were a resident that you remember that maybe still comes to your mind, especially for oncology, or any unforgettable, unique experience during that time period that
Well,
motivated you?
well, I think in my training, there's a lot of events that have happened. In fact, I think as I was in the first year of training, we were having those long calls, that 36-hour calls. And I remember we as interns formed a union, not only in our program, but throughout the state of New York, went on strike and was able to revoke that long hour calls. And instead, I mean, I still clearly remember those sleepless nights, so many near misses that happened because of being so tired and sleep deprived all the time. But I also remember so many fun times that I had with my friends and colleagues in residency, and learning what not to do from observing others. I think those were the greatest life lessons I learned. I learned how important bedside manners is, probably from learning not what not to do from most of them. And I would say something that resonates to me quite often, as I think about, a lot of changes that keeps on happening, even right from my training days. I remember the saying by George Bernard Shaw, who said that reasonable people adapt themselves to circumstances, whereas unreasonable people adapt circumstances to themselves. And progress depends on unreasonable people. For some reason, this resonates in me often because I feel like I've been through tumultuous changes
That
in my life, let alone training programs.
I would have you explain that to me later, because it's a little bit too high for me, but I know that you could understand it when you read it the first time. But uh
It's just the changes that you
it's the
go through.
changes that you go through. I can see
Yes.
that. I have uh to say that, given the fact that we are going through a big change as COVID-19 has hit us, uh, and it has affected doctors' lives, nurses, patients' life, our healthcare system. And leaders like you that come out of those crises that you explained, like during your residency, you actually took the role of uh, representing your co-fellows and residents. I think we look forward to your leadership during this crisis at our current center. So, and leaders, they continue to evolve and improve themselves, and that's what your quality is too. So I'm looking forward to that. I want to ask you, what is your uniqueness? How would you say, well, this is something that is unique to me, Sramila, and I want to know about that. Um, and don't feel like you're self-praising. We just want to inspire others.
Well, I don't know what to say, but I believe, as my faith in God, that we're all created unique and special for a purpose. I believe that, for me, God is the potter and we are the clay. He has never made any carbon copies, he only makes originals. But I believe that the purpose in my life is to put others' needs before mine by serving them through the gift of healing. I'm so passionate about my work. I feel that's unique to me. I put my heart and soul in it. And I feel
I
blessed every day.
I can
That's
see
what
the
keeps me
altruistic side
motivated.
of you, the compassionate side of you. I remember just the last year we had a colleague friend that comes here not too often, and she had concern about her area of concern that she had, that you are an oncologist for breast cancer and oncology. And I remember we walked up to you, and she did not know you, and you opened your door like she knew you for a long time. And I was like, wow, she's such a wonderful person. You were just doing your work, and you're like, come on. And I was very impressed at how you took on that colleague to take care of her. I know you take care of many of our own colleagues, parents, and their relatives. You do a great job. What is your idea of a dream job as a physician? What do you think that physicians look for in a job?
Um, I think I'm living my dream job. I would say that this organization that I'm working for in the last 13 years, actually, wow,
Wow.
it provides me the platform, the resources to care for my patients like one would care for their mother. I mean, their vision and their mission is in alignment with my passion and interest. And that's one of the reasons why I chose to work here and continue to work here. I mean, I understand the challenge of improving the lives of these patients that are afflicted with cancer to the best of my ability. The strength, the resilience of what my patients go through is what keeps me motivated and improving my learning. I've also gotten to love Philadelphia and South Jersey, where I live, for the warm, loving connections that I've made with people around here. And, we've had lots of fun times. We've grown here, is what I feel. My daughter has grown up here, gone to school here. And I think any
Yeah.
place you're at, you can make it your dream place if you put your heart and soul in it.
And how you run a team of the breast center for excellence, center of excellence, breast cancer center of excellence, and how your team and you guys are like well connected uh, members, um, and your nurses. Sometimes I come up and attend your morning rounds, and I always come back and I was like, I could do better. So you always inspire us to actually
Um,
work together as a team and improve our plan of care. So now you are gonna be you have more responsibilities on your shoulders, and I know it's a part the excitement and responsible role that you are taking up as the leader in the field of oncology at our center. 5 years from now, what do you see happening, and where do you want to take this institution?
Um, I think I want to put in all of my learning and experiences into improving patient care. I don't think anything outbeats that part. Patient care is priority for me and my passion and interest, and I want to continue to make an impact in their lives as well as mine. I also have a deep interest in making our breast center as one of the highest level of care of advanced oncology and center of excellence. We want to be the best in delivering care. We want to be there as a greatest differentiator, although the treatment that we offer here is evidence-based and standard as anyone would do, but the level of personal care and attention and personalizing, I want it to become the best. That's one of my interests and what I look envision to. I also love to be more involved in education, I would say, write a book maybe, although I have no clue. I want to be a support and guide for my daughter as she is going to join college in a year from now. And I also want to be able to support my husband. He's got a very unique job, his innovative career. I want to be able to help him out as well.
Wow.
So these are
We'll
some of
dig
the
into
things I could
deeper.
think of.
Yeah, well, I think that's why I always think that we need more leader women in this country, in this world. See how well-rounded your approach was? Most people only talk about, okay, I want to take the company up there. I want to make this much money or do these metrics. But look how you included everybody in your dream, and you're like, from your patients to your organization, your colleagues, your daughter, your husband, you bring along everything. We need more
Well,
leaders like
that's my
you.
life.
Yeah, but
That's
it's
my
it's
life.
it's it's something very unique to women, especially. That's why I want to see them more in leadership position. As a seasoned physician, have you seen any roadblocks in current health system that you think we need help, we need to overcome that? Was there any comments you would like to give on that topic?
Well, there's definitely a lot of roadblocks. I would say the biggest hurdle probably has been the constant change in the field of healthcare, which seems to interfere in patient care on a day-to-day basis. Whether it's insurances dictating in what we can or what we cannot do in terms of patient care, I would say is one of the biggest roadblock. Lack of consistency in the current healthcare situation, that's another biggest roadblock. Not having to not having or making time to connect with friends, I would say, as much as I want to. Um, Another roadblock, I would say it's a constant struggle for me to be able to balance work and family life.
Yeah.
Having a single child may seem easy, but it is challenging for me to keep my daughter engaged, to be involved in shaping her pathway, involving imparting family values, empowering her to stand up for what is right. It's a challenge. I think my family is my greatest source of support in overcoming or achieving this roadblock. I think staying positive and doing the best in the situation is my way of overcoming all these roadblocks. Obviously, I cannot change everything, but trying to do the best in the situation and keeping positive. That's what I would say.
Wonderful. That was our next question, and I thank you that you actually mentioned that being human is what you exactly said, and being true to yourself. No one is perfect all the time, but doing our best to to justify our time at work, at our home, and a family, and I appreciate that comment. My question is, if you look back 20 years from now and you have now that experience, wisdom, knowledge, and you look at your 20-year younger self, like your daughter, what is a lesson of life that you could give her or people listening to, maybe medical students or residents, that you want to tell them?
Um, I would say lots of things, probably. Um, well, I would say it's a good thing to balance what is known between a fact that has happened to what I make up of that fact in my life experiences. Know the difference between the two. I think that's a great thing. I always encourage, including my daughter and anybody younger child that I come across, follow your dream. Don't let anyone make you believe that you can't do it. I still think, in my opinion, being a physician is the greatest profession. It's such a noble profession. Do it right if that's your calling. And I know it was mine, and it is mine. And be the change you desire. I really want to build each other up in my field, especially my friends and colleagues, and try my best. I know sometimes it may not always happen, but the biggest thing is try not to divide us or tear us apart.
Yeah.
Success in life, I tell my daughter this and others too, has so many ingredients. It's not by chance, it's not by luck, it's not something that you inherit, at least not for us. We built everything from scratch. But I think there's some of the ingredients includes being, focused, having hard work, being responsible, being accountable, being authentic, being having that integrity. I think all of those, I feel, are
So,
life principles.
Sramila, that's very good advice, and I think all of us could use that. Slow down and look at our lives and reflect upon it. One thing I want to ask you, as I said in the start of our conversation, you have a very good memory about minute details about your patients. Can you share a tip? How do you remember that? Do you keep a picture of a patient and try to remember that? Or does it come natural to you? Honestly, it's one of those unique things. I have never seen anybody like you who knows so
Oh
much
my
about the
God.
patient. How is that
I
possible?
I wish I would have that kind of memory all the time. I don't really, honestly. I wouldn't even know what I ate for breakfast. I feel that my memory comes when I have put my passion into something. So when I'm at work, I'm so focused on in my work. I'm so invested in my patient. I want to do the best for them. So that's why I try to make sure I know everything about them when I go into the room, because I don't take my computer with me, and I want them to feel at that moment that it's only them that matters to me.
Wow,
It's
what
all
a
about them at that time. So if I don't know about them, I cannot do justice. So that's why I try to learn about them before I
I
do.
have to shadow you more in your clinic. I need a lot of learning from you. Okay. So and last question is, and you could give us a are you fond of reading books, or is there some movie, something that you want people to learn to improve their lives, that you like to share with us? Um,
Um, yeah, I mean, I used to read a lot of books in my younger age, but not so much as as I would love to. But I think of two books that come to my mind. There is one book. It is called In Shock: My Journey from Death to Recovery and Redemptive Power of Hope. It is by a physician named Rana Awdish, Awdish.
Okay.
I feel, I mean, I typically don't like to read sad books, but this is one book I feel that it should be read by every medical student. This is a book about first person account from a young, I think she's a critical care physician, who at the end of her training suddenly started fighting for her own life. She was
Mm.
pregnant, she lost her child, she had multiple surgeries, overlapping organ failures, whatnot. At each step of recovery, she was faced with so many challenges. So she offers a new paradigm and perspective in her journey of fighting to live. So I think this is great
I will
for us
look
as
it up
physicians.
and try and put it in the description
Yeah, it's
section.
called In Shock.
In Shock,
In
and I'll look
Shock.
and
Yeah,
I'll try to
S.
see if we can find an Amazon link and people can. I'll definitely go look up on Audible. Thank you for sharing that. So, Sramila, this will conclude our professional session, and thank you for giving the time. But audience, please stay tuned because we are coming back with a fun part of Sramila's life. Thank you.